My name is David Morales. I'm going to be doing a presentation on looking into the comparison of the United States and France healthcare systems. For today's agenda, for this presentation, we will cover a brief introduction, an overview of the U.S. and France healthcare models, delivery of primary healthcare along with women's health, children's health, hospital care, dental care. Let's go to our next slide. For decades, there has been a growing concern among Americans as to why the U.S. healthcare system is flawed, while countries like France, for instance, have a higher quality of healthcare system which offers universal coverage for all French citizens to no matter their age, income, or economic status. In this research, we are going to analyze and compare what makes France have a superior healthcare system and identify ways the U.S. may adopt their principles and practices to improve the overall quality of the U.S. healthcare system for all its citizens. Now let's do a side-by-side comparison of both countries on the next slide. First, in order to look at the big picture, we need to compare their populations and healthcare costs. According to world data, the U.S. population is approximately over 329 million people, while on the other hand, France's population is approximately 67 million. As you can see, France life expectancy is greater by 4 to 5 years. According to the OECD, which is the Organization for Economic Cooperation and Development, latest data, in cases regarding ischemic health disease and mortality and obesity, France has significantly lower rates, while mental health issues like dementia, the U.S. has lower rates. Since the U.S. has the highest cases of chronic health disease and obesity, this is one of the main factors that has led the U.S. to have the highest health expenditure in the world. Most of France's health success has relied on focusing on preventative medicine, which results in patients less likely to return to follow-up care visits, thus spending less money on healthcare. In addition, the French healthcare system allows its patients more choices when it comes to treatment options because they are not restricted by insurance companies as Americans are. This promotes patient autonomy when it comes to treatment options and less money put on unnecessary testing and medications. Lastly, as for insurance coverage, 99.9% of France's population is covered by insurance, and 1.4 of their final household consumption goes to out-of-pocket expenditure. While on the other hand, the US covers 90.9% of its population, and 2.5% of their final household consumption goes to out-of-pocket expenditures. Due to high healthcare costs in the US, a higher percentage of Americans are skipping medical consultations and medications, which lead to more health complications and higher expenditure in the future. Next, let's look at an overview of the French healthcare system. The French healthcare system is considered a universal-based healthcare system. The public health insurance is funded partially by French Social Security contributions and deducted from workers' salary. It covers between 70 to 100% of healthcare costs, such as doctor visits and hospital admissions. For low-income and long-term sick population, they qualify to receive 100% healthcare coverage. As for private insurance, patients with public insurance can access most private-run hospitals, although there will be higher costs. The public health insurance will cover the same percentage of cost, but the patient is responsible for that part that isn't covered. For this reason, French patients take out supplemental and private insurance to cover the remaining balance not covered by the public health insurance. Now let's look at the overview of the U.S. healthcare system on the next slide. The U.S. healthcare system primarily consists of private health insurance, Medicare, and Medicaid. The primary source of payments for healthcare services comes from employer-provided health insurance. Unfortunately, due to health insurance being so expensive for employers in recent years, those costs have been trickling over to the employees, which has increased cost sharing for workers. There are four types of private insurances, which are individual, group, managed care insurance, and self-funded. Individual private health insurance consists of individuals who own a small business and they purchase their own health coverage. For group insurance, it consists of large groups of people who purchase insurance coverage through their employer, and the risk is spread within that large group. Managed care plans combine administrative and service costs to help control the overall healthcare costs for their member. And the most common type of managed care plans are HMO and PPO plans. Usually these managed plans have contracts with certain healthcare providers and facilities to provide care at reduced costs for their members. Lastly, self-funded are health insurance programs that are applied and managed by the company itself. To the right is a breakdown of insurance coverage. According to USA Facts, aside from private health insurance, which contributes to 68% of health insurance coverage in the US, Medicare consists of 18.1%, Medicaid consists of 17.2%, while the remaining 8% of the population is uninsured. Next, let's do a side-by-side comparison delivery of primary care. In France, the first line of healthcare starts with family doctor or internist. The patient is to choose any French doctor, but in order to receive full reimbursement through the public healthcare system insurance, they must register with them as their primary doctor. If the primary doctor refers you to a specialist, 70% of the consultation and treatment will be reimbursed. In the event the patient chooses their own specialist, the fees will be higher and they will receive less of a reimbursement. Lastly, referrals are not necessary for consult pediatricians, gynecologists, or ophthalmologists. Now, as for the US, primary health care is delivered by three specialties, which are family medicine, general internal medicine, and general pediatrics. Depending on the healthcare plan the patient may have two options when it comes to seeing a specialist. First option is that they may call the specialist directly, make an appointment, and be seen by the specialist. This is usually the case for patients who have PPO insurance plans. So basically they're bypassing their primary care physician. The other alternative is obtaining a referral from their primary care, making an appointment to see the specialist, and usually this is the case with patients who have HMO plans. Next, let's see an overview of women's health in France. Women healthcare services are available through a gynecologist, which is accessible through the public health insurance. Referrals aren't needed, and patients are free to choose their own gynecologist through Amélie website, which is a French social security website. In France, most pregnancy costs are covered by public health insurance, but the Health Insurance Fund and Family Allowance Fund need to be notified within 14 weeks of pregnancy for their costs to be covered. Birth control costs are approximately 65% reimbursed, and a prescription is needed. Lastly, there are breast cancer screening programs for women 50 years of age and older. Among with that, breast and cervical cancer examinations, which are recommended to be done every 2 to 3 years, starting for women older than 25 years old. Now let's take a look at women's health in the United States on the next slide. In the U.S., women healthcare services are available, but despite the efforts of ACA, which is the Affordable Care Act, most women have highest rate of skipping healthcare needs due to costs, unable to afford healthcare, and overall not satisfied with the U.S. healthcare system. It is for this reason that the U.S. has the highest rate of maternal mortality due to complications from pregnancy or childbirth, along with the highest rate of C-sections. On a positive note, the U.S. does have one of the highest breast cancer screening rates, along with one of the lowest breast cancer related deaths. This is mostly contributed to the advancements in diagnostic technology and breast cancer awareness campaigns. Most healthcare plans cover preventative services such as pap smears and bone density exams for women without charging a co-payment or co-insurance. Breast cancer mammograms are also covered and are recommended for women over the age of 50 every 2 years, as well as for women between the ages of 40 and 49 with high risk of breast cancer in their family. Unlike France and the United States, most healthcare plans cover birth control pills with low cost out of pocket or free for qualifying patients. Lastly, the cost of pregnancy and delivering a baby has drastically increased in recent years. According to an article from ABC News, between 2008 and 2015, out-of-pocket costs for maternity and child care has increased from $3,069 to $4,569 and continuing to rise. The largest contributor to this increase is the growing use of high-deductible insurance plans selected by employees. Now let's take a side-by-side comparison of children's health for both countries on the next slide. In France, children have accessibility to healthcare through their parents' public health insurance, which includes free dental checkups until the age of 18. Children have 20 mandatory screens that range from birth up to the age of 6. These mandatory screening involves checking for diabetes, genetic disorders, hearing disorders, language and learning deficits, and visual disorders. During the screening process, the child is granted 3 separate child health certificates by their doctor, which are given within 8 days of birth, after 9 months old, and after 2 years old. Lastly, France has a list of 9 mandatory vaccinations that a child must receive, ranging from 0 to 13 years of age. As for the United States, since there is no universal health care plan to cover children, they are either covered under their parents' private insurance or a Medicaid plan. In the event that a parent earns too much to qualify for Medicaid, but are unable to afford private insurance, the child may qualify for CHIP, which stands for Children's Health Insurance Plan. CHIP is mostly funded by grants provided by the federal government. They do charge premiums, but the child's family will not be charged more than 5% of the family's annual income. CHIP covers routine doctor's visits, immunizations, prescriptions, dental, vision, hospital care, emergency services, along with imaging and lab services. Now let's look at the next topic, hospital care in France. In France, there are 2 types of hospitals: state-run public hospitals and private health clinics, hospital clinics. Once you are admitted to the hospital, the patient is responsible for 2 fixed sums. The first sum is a daily charge of 20 euros, which is equivalent to $22 US American dollars, which includes the patient's bed, meals, and heating needs. The second sum is for 24 euros, which is about $26 US dollars, if the patient is receiving medical treatment exceeding 120 euros and is applied only once for the hospital admission. Certain treatments are covered 100%, such as x-rays or scans like CT scan or MRI, specific lab tests, emergency transportation to the hospital, long-term care for patients who are staying over 31 days, pregnancies, and patients suffering from work-related injuries or accidents. Next, let's take a look at hospital care in the United States. In the United States, there are three types of hospitals: public, community or volunteer hospitals, or proprietary hospitals. Public hospitals are perhaps the oldest type of hospital and are usually owned by either federal, state, or local governments. An example of a federal hospital is, as we know, as the VA, which is the Veteran Affairs, which is the largest group of federal hospitals in the U.S. They serve federal patients such as military personnel, veterans, and Native Americans. Next are the community voluntary hospitals, which are nonprofit and privately owned institutions. They operate by receiving contributions and funding from community organizations. Lastly, we have proprietary hospitals. They are for-profit facilities, and they're owned by individuals, corporations, and partnerships, and their objectives are to treat patients while at the same time meet financial commitments to their stockholders. Hospital stays in the U.S., when compared to that of France, are significantly more expensive, and in fact are among the highest in the world. The average cost of a hospital stay in the U.S. is well over $10,000 per day, and if the patient is admitted to the ICU, it's even more. In the event where a patient is seriously ill, for example, a patient battling cancer, their medical expenses may cost hundreds of thousands of dollars. Now for our last topic, let's look at a comparison in dental care for both countries. In France, the dental costs are reimbursed by France's health insurance, public health insurance, which usually covers up to 70% of costs and have low waiting times for dental work to have done. The basic dental treatment covered by public health insurances include services for gum disease treatments, tooth extractions, and cavity fillings. Dental services like porcelain crowns are expensive, and since most of the French private insurance includes dental treatment, this is used to cover the difference not picked up by the public health insurance. Orthodontic dental work such as jaw irregularities, braces, and dentures are not subject to government reimbursement and are out-of-pocket costs. As for the U.S., dentistry is usually separately covered from medical services. Medicare does not cover routine dental services, but patients who have Medicare Part C, also known as Medicare Advantage, it does cover around 94% of his patients. Children who come from low-income families and are enrolled in Medicaid, dental coverage is provided by the Early and Periodic Screening, Diagnostic, and Treatment Benefit, also known as EPSDT, along with CHIP, to provide dental services to children under the ages of 21. A growing issue in the U.S. is that, according to the CDC, in 2019, roughly around 50% of the patients between the ages of 18 and 64 with private insurance had dental coverage within the last 12 months. Experts believe that providing children with adequate dental coverage is important, but there remains a gap between the middle working class, and seniors. It's important to encourage and have proper dental coverage for these groups of people as well, because poor oral care is linked to medical complications and other diseases. Let's proceed to our next slide. In conclusion, both countries have large populations, and while a universal healthcare system may help promote healthcare access, it's not a perfect system. It too can be pricey, and out-of-pockets can be expensive. Each country must find ways to contain or reduce healthcare costs, be more efficient in providing quality service, promote fairness and provide affordable healthcare access to the various groups of people in respected societies for primary care, women and children's health, hospital care, dental services, along with other necessary healthcare needs. Another thing to consider is that hospitals need to find more efficient ways to reduce length of stay for patients by providing quality healthcare with appropriate inpatient treatment, proper discharge planning, and education, which will ultimately reduce healthcare costs. Lastly, there needs to be more focus on preventative care because in the long run, it will help decrease expensive healthcare costs. Thank you for your time and hope you enjoyed this presentation.